Welcome to NAMI Chicago. We're so grateful that you're here. We're so grateful to Cook County for their incredible partnership, particularly President Tony Preckwinkle, Commissioner Anaya, who is on their way, and Commissioner Degnan. I am so thrilled to introduce you to President Preckwinkle. And by the way, I'm Alexa James, CEO of NAMI Chicago.
Thank you. Good morning, everybody.
Good morning.
I am very grateful to see all of you here this morning. I have never been to NAMI headquarters, so this is a new experience, and I'm grateful that they are expanding their helpline with the support of Cook County Health. I want to acknowledge our Cook County commissioners, Commissioner Degnan and Commissioner Anaya, who will be joining us shortly, and the community leaders who have joined us today. Alexa, thank you for that kind introduction. And I understand Jasmine Watkins, who's Chief Program Officer of NAMI, will be speaking as well. Dr. Tom Nutter, who is Chief Behavioral Officer for Cook County Health, and Nikki Lynette, who's a social impact artist and a NAMI board member. So thank you all for joining us. We're grateful. I'm grateful that all of you are here and for your support. Your work on this initiative will make a meaningful difference in the lives of our residents here in Cook County. The expansion of the NAMI helpline is an important step forward. It provides timely, trusted support and meets residents where they are, by text in the palm of their hands. The work we're talking about today is important because we're living through a mental health crisis in this country. It affects people of all ages, races, and backgrounds. It affects all of us. And while the need for support continues to grow, access still lags behind. According to the Kaiser Family Foundation, which does a lot of research on healthcare, as of 2022, about 50% of white adults with mental health needs receive services, but only 40% of Hispanic adults and a third of Black and Asian adults. These numbers show that too many of our residents are suffering in silence because they don't know where to turn, or because of cultural issues that discourage seeking help. This helpline is designed to change that. It reflects Cook County's broader commitment to health equity, ensuring that every resident, no matter their zip code or circumstances, can get the help they need and deserve. Mental health is health, and everyone deserves the chance to live a full and healthy life. By investing in the NAMI helpline, peer support groups, and community outreach, we're building a system rooted in compassion, connection, and care. One that says clearly, no one in Cook County should have to navigate their mental health journey alone. I want to thank you all. I want to thank, in particular, Dr. Nutter, who is with us today, because he is in charge of our behavioral health initiative in Cook County Health. Historically, we always had a strong physical health footprint, but unfortunately not a strong behavioral health footprint. And I'm grateful to Dr. Nutter and his team for helping to build that behavioral health unit within our health and hospital system. And now I'd like to bring Commissioner Degnan to the podium, with apologies that I have to leave shortly. Commissioner Anaya has arrived. Thank you. I said earlier that Commissioner Anaya would be joining us shortly, and here she is, Commissioner Anaya, who is the Vice Chair of the Health and Hospital Committee on our Board of Commissioners. Thank you.
Good morning, everyone. Good morning. I'm super excited to be here today. Just within the last week and a half, so Madam President, we've done a lot of ribbon cuttings. We've done a lot of great work. Yesterday we were in Bronzeville opening a new clinic, and I keep repeating the fact that Cook County has really stepped up, and Cook County Health and the partnerships that we've created have really made some really impactful changes. And I'm extremely proud to be a small part of those conversations, but also the collaboration and really the networking that's happening for us to really join forces and really make some really meaningful change. Again, my name is Alma Naya. I'm Cook County Commissioner of the 7th District. I am the Vice Chair of Health and Hospitals at the county, and I'm honored here to join the National Alliance on Mental Illness, or NAMI, in celebrating the expansion of the Chicago Helpline to reach more people via text and chat. I want to thank the Cook County team, Dr. Nutter, of course, Madam President, and her team for this invitation. Like I mentioned, as Vice Chair of Health and Hospitals Committee, I am very grateful that Cook County is doing the direct investments in these efforts to expand behavioral health offerings. This comes in the light of a lot of other investments, including additional investments to other partners, right, that we've seen the last few years. These are millions upon millions of dollars that Cook County is investing in mental health because we've had to step up. All too well, we know that mental health challenges can happen to really anyone, yet access to care is not widely available. These are stigma folks have to overcome. If you don't speak English, if you may think that you may not afford therapy, if you maybe find yourself in a difficult situation at home or without anybody to turn to, these are just some examples of the barriers preventing many folks from receiving access to care. NAMI Chicago is leading the way in expanding access, and that makes all of the difference for individuals and communities that maybe have never seen that as something that they can get. Text and chat is especially important when reaching young people or those who don't feel comfortable verbalizing their struggles. I'm very grateful for the partnership in this space in Cook County Health, the fact that they're tapping into every tool possible and available, and again, that this partnership is being created. Buenos días, mi nombre es Alma Naya, yo soy comisionada del Condado de Cook, del 7º Distrito, represento el suroeste de la ciudad de Chicago. Muchas de las personas que yo represento son inmigrantes, son latinas, quizás no hablan bien el inglés, y hoy estoy aquí con un gran honor de unirme a la Alianza Nacional sobre Enfermedades Mentales, o NAMI Chicago, para celebrar la expansión de la línea de ayuda para utilizar mensajes de texto y chat. Como vicepresidenta del Comité de Salud de la Junta de Comisionados del Condado de Cook, estoy agradecida por cómo el condado ha invertido directamente en esfuerzos para ampliar las ofertas o acceso a salud mental. Muy bien sabemos que cualquier persona puede sufrir de problemas de salud mental. Sin embargo, el acceso a la atención necesaria no está tan amplia y disponible como quisiéramos. Hay estigmas que la gente puede tener sobre su salud mental. Quizás una persona no hable el inglés. A veces pueden creer que no pueden pagar por terapia o se encuentran en una situación muy difícil en sus hogares. Estos son unos de los ejemplos de barreras que impiden a las personas acudir a ayuda. NAMI Chicago está marcando la diferencia en nuestras comunidades. Los mensajes de texto y chat son especialmente importantes para llegar a los jóvenes y aquellos que quizás no se sienten cómodos en verbalizar sus luchas que tienen. Estoy agradecida a todo el condado y a todas las personas que han hecho esto posible. And with that, I will ask Commissioner Degnan to come up. Thank you.
Good morning, everybody. Good morning. My name is Bridget Degnan. I'm the Cook County Commissioner in the 12th District, which covers much of Chicago's north and northwest side. And I'm so happy to see so many friendly faces here today and people that NAMI has dedicated to work with the county over many, many years. So I'm just so pleased to be here. So I just want to mention, and this is something that I think I've mentioned many times before, is that you cannot make it through adulthood in some way without being broken. There is mental and behavioral health issues in each and every one of us. We have had our heart broken. We have had a family member die. Something has led us to lean on our friends, to lean on our family, to lean on our neighbors in order to help us through a tough time. And that's why NAMI is so incredibly important. Because the people that sometimes we lean on don't always have the skills necessary to get us through that tough time. And so NAMI is really there as professionals, as people who can help and coordinate and connect each and every one of us to services. So as Commissioner Anaya just mentioned, many people feel that they cannot afford therapy or mental health services. And that's why NAMI is so critical. So I just want to one more time repeat, the number is 833-626-4646. 4244, 833-626-4244, and that's the call and the text helpline. Every single person can access this. And in partnership with the county, Dr. Nutter, Cook County Health and Hospital, and President Preckwinkle, this collaboration today really just takes mental and behavioral health and our commitment to it as a government to the next level. Because I think historically, when you think about healthcare, it's always, as President Preckwinkle said, is the physical part. But the mental and emotional part is just as important. Because if that is not fostered and that is not nurtured, your physical health will deteriorate. They're inextricably combined, and it's incredibly important that we look at them that way. In the last 5 years, the county has given significant resources to our mental and behavioral health group. We've hired Dr. Nutter. He's created a team. He had a huge mental health symposium, the first of its kind in the county recently, and he'll continue to work in that direction. So I'm just so pleased to be here as a partner to support this initiative, to see the dynamic ways the county can move forward, because not all governments are this dynamic. Not all the governments that you're going to see in and out of Illinois can look at an issue, can address that issue, and can make those meaningful steps to move forward and resolve the issues. Now, mental and behavioral health issues can be a lifelong situation, or they can be situational that really just need a little bit of help. Regardless, NAMI and the county are here to help and support you in every single way. So thank you so much for having me, and thank you, Dr. Nutter and Cook County Health, for all you do. And yes. I would like to next introduce Dr. Tom Nutter, who is the Chief Behavioral Health Officer of Cook County Health.
Good morning. As was mentioned, I'm Tom Nutter. I'm a psychiatrist and Chief Behavioral Health Officer for Cook County Health, and it is my privilege today to say a few words on behalf of CCH's Office of Behavioral Health. There's a lot going on in the world these days, and much that is upsetting. But we are grateful to be here today. We are grateful to President Preckwinkle for her vision and leadership in creating the office in which I'm now honored to work. We are grateful for the service and support of each of the Cook County commissioners, and thank you in particular to Commissioner Anaya and Commissioner Degnan, who are here today, and thank you for your kind words as well. And we thank each member of CCH's supportive board of directors. We are grateful for Dr. Merkitis for his strong, thoughtful leadership, and we are excited to be able to support NAMI in expanding the helpline and now adding text and chat functions. So why, in these challenging days, invest more than $7 million over 2.5 years in a helpline? First, and I'm saying this as a psychiatrist, it makes a world of difference clinically. For those struggling with a psychiatric condition of any kind, depression and anxiety disorder, PTSD, substance use disorders, any condition, reaching out for help often isn't easy. Thousands of people who need that care never get to the point of being able to seek it out. And for those who do, and I'm saying this again as a clinician, I've often said that people arrive at that phone call or that text or chat in a place of 51% wanting help and 49% for a whole myriad of reasons not being so sure that they want help. And to meet people at that moment, wherever they are in the county and whatever their circumstances, with a trained, empathic mental health professional who has an extensive database of resources at their fingertips is a tremendous, tremendous thing. Quite simply, the helpline will often be the difference in whether or not someone engages in care and whether or not they receive the right care. Having capable, compassionate guidance matters throughout an individual's behavioral health treatment, but it's particularly crucial at the front door. At a time when many of our systems of behavioral health care are struggling to provide optimal new patient access, having a single point of contact for not just one system of care, but hundreds, means that those seeking behavioral health services are much more likely to be able to receive that care when they need it rather than months later. Having a high visibility single point of contact also increases public awareness of services, improves the chance that when a person discloses needing help to a trusted friend or family member, that friend or family member will be able to steer them to help rather than that into what can be a frustrating maze of options. From a public health perspective, we're hopeful that this expanded helpline will generate actionable granular data on access throughout the county, allowing us to more proactively address gaps in systems of care as they arise. Last and not least, Investing in the Helpline is the right thing to do because we know we have the right partner in NAMI. We know that, Alexa, that your team can do the work and perform it at the highest level for all residents of Cook County. We are grateful for the leadership of NAMI Chicago, for the team you've assembled, and the trust that NAMI has earned and will continue to earn in the coming years. Thank you. And with that, I'm privileged to introduce Jasmine Watkins, who's Chief Program Officer for NAMI Chicago.
Thank you so much, Dr. Nutter. We're very grateful for your partnership. Thank you to President Preckwinkle. Thank you to Commissioner Anaya, Commissioner Degnan for being here today, and thank you for your leadership in advancing mental health. Here at NAMI Chicago, we strongly believe that no one should have to struggle alone, which is why we're so deeply committed to making sure that it's easy for people to reach out and ask for help when they're not sure what they need or where to go. As Dr. Nutter mentioned, our helpline is a no-barrier entry point. It is free, it is confidential, and it's here for anyone, no matter what they need or where they are or who they are. Here at NAMI Chicago, we center everything we do in equity because we believe that where you live shouldn't determine your ability to access quality mental health care, nor should your background. As you've heard, with the launch of this latest feature, people will be able to connect with our helpline team through text and chat, making it even more easier to engage with our care in a way that feels comfortable. When someone reaches out, they will get gentle guidance from real people who are there to listen without judgment and connect callers to the support that they deserve. We're so grateful for this investment as it will allow us to give both people and providers a real resource to turn to, and it's also going to enable us to expand our peer support so that people can engage with trusted partners in their community and get support from people with lived experience, and we're hopeful that these peer support groups will lead to a sense of belonging, mutual support, and an opportunity to connect with others in a space that most importantly already feels safe and supportive to those individuals. And then lastly, to make sure that everyone knows that this help exists and that they feel confident in engaging with it, we are launching our county-wide engagement and awareness campaign. And so beginning in March, which is Mental Health Awareness Month, you'll start to see ads across Cook County, and you'll see our engagement team out at some key major community events this summer. Which is just the beginning of a more connected and compassionate mental health care system here in Cook County, and we definitely couldn't be more energized, excited to move forward in this partnership. We here at NAMI Chicago are here for you or anyone you know who needs support. So thank you, Commissioner Degnan, and I will reiterate the number is 833-626-4244 for texting or calling. And if you want to chat online, you can go to namichicago.org. Our team is here and available. Our hope is that you will also save the number. We know that sometimes immediate support is not what you need, but we want everyone to know that this number is available when it matters most, maybe at some point in the future. And now it's my pleasure to introduce Nikki Lynette, a social impact artist, a suicide survivor, and we are so lucky to have her as a member of our board of directors here at NAMI Chicago. Nikki?
Thank y'all for being here. It means so much to us to have y'all here at our new offices. As was mentioned, my name is Nikki Lynette. I'm a multidisciplinary artist. I'm a NAMI Chicago board member. I'm a trained lived experience speaker through NAMI Chicago. And I'm a suicide survivor who began my mental health journey by calling NAMI Chicago. As was mentioned before, May is Mental Health Awareness Month. It's coming up. And in the spirit of that, I want to speak not necessarily to the people who are struggling, but to the people who love someone who might be struggling. Often, when I talk to people about mental health and the current state of the mental health crisis, they don't have very compassionate things to say. They say that this generation has it too easy. They say that they're soft. They say that they're entitled. They say that they're fragile. Imagine confronting that attitude when you are at your lowest. I know how that feels because it happened to me. But fortunately for me, when I didn't have understanding from family and friends, I had NAMI Chicago. None of us want to be the person who says the wrong thing to someone who's struggling. And NAMI Chicago is here so that none of us have to. And while we can never replace the important role of family and friends in a person's mental health journey, what we can do is help. People who are struggling are so often living a life that is void of hope. Like the gentleman said, we're about 51% wanting help, 49% not believing that anything can. At NAMI Chicago, we believe that removing barriers to care saves lives. And that is what this text and chat line is all about. Removing that barrier to care, because when you remove barriers to care, you are removing barriers to hope. For a lot of us, contacting NAMI is the first step towards saving our lives. So to everyone in this room, to everyone watching this, to everyone who supports NAMI Chicago, thank you for helping people like me save ourselves.
Everybody, you are so powerful and honest, and particularly Nikki, thank you for being such a champion and for sharing your experience so other people feel safer to do so. You know, our staff from the Helpline is watching right now and supporting, and we're so proud of them. None of this could be possible without the incredible, committed individuals who run this work. We are so grateful for them, and I hope you all get a chance to talk to them one day about yourself or somebody that you love. I want to thank our partners at Cook County Health. You guys have been tremendous thought leaders, innovators. You've pushed us, and we couldn't be more grateful. And of course, thank you to the commissioners for speaking so much truth and so much support. Thank you all for being here today, and stay dry and safe.